Today, we're going to be talking about a subject that is near and dear to my heart, and that is breast cancer. It's all too often being more diagnosed lately, and there are some signs and symptoms that you should watch out for that you should not ignore. But before we get started, I'm Shannon. I'm a certified nurse midwife and I specialize in obstetrics and gynecology. And I've been caring for women for the past 23 years. If you have had breast cancer, if you are a survivor, great job. If you have any comments about your symptoms and how you presented or how you found out about your breast cancer, leave me a comment below. Like and subscribe and share this video with other women if you feel like it may be helpful. Without further ado, let's get started. Breast cancer is reaching epidemic proportions in the United States today. Breast cancer is when the normal cells in the breast tissue start to grow abnormally and multiply abnormally. Breast cancer does not only affect women, men are also affected and should monitor for signs and symptoms of breast cancer. Let's get into 7 signs and symptoms of breast cancer that you should never ignore. Symptom number 1, abnormal breast swelling. Hormonal changes or influences on the breast tissue during your normal period time frame. Okay. Any other time of the month, not normal. You should not have, one breast that significantly enlarges over the other. Symptom number 2, nipple discharge. If you have any discharge from your nipple, that is not normal unless you are breastfeeding. Symptom number 3, skin dimpling. Skin dimpling can happen under the breast tissue. It can be on top of the tissue. The skin can start to resemble the texture of an orange peel. Symptom number 4, breast or nipple pain, not associated with your cycle or that doesn't go away after your cycle. Hormonal influences on the breast tissue can cause some tenderness. Pregnancy can cause tenderness in the breast tissue. But if you're nowhere around your cycle time, if you're postmenopausal and you're not having a cycle, you don't have those hormonal influences. Symptom number 5, if you normally have a nipple that as soon as cold air hits it or any stimulation, that it sticks out, and you all of a sudden start to notice that it's going in almost like it's being pulled in from the inside. 6, swollen, enlarged, tender lymph nodes. Your lymph nodes are in your body to help transport toxins out of your blood. And whenever there's any kind of infection, i.e. cancer, you can have those lymph nodes become enlarged. Symptom number 7, this is the obvious sign that women think of when they think of breast cancer, finding a lump or a mass. It's always better to be on the safe side and not just to dismiss symptoms. As with any other disease process, diagnosis early on can improve your chances of survival and recovery and going into remission. Like I said, if you have had breast cancer in the past, drop me some comments below and let me know how you found your breast cancer. Was it with a self-breast exam? Was it any of these symptoms we reviewed? Was it on your yearly mammogram? Ladies, make sure that you are getting your yearly mammograms and don't use that as a substitute for not checking your breast. Even if you are getting your yearly mammograms, make sure you are checking your breasts once a month. And if your partner notices any changes in your breast tissue, call, 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 call. I hope this information was helpful, and I will see you guys again soon. Have a great day.